So hello again. Thank you all for joining us in our webinar, Finding Common Ground, Resolving Conflicts in Family Caregiving. My name is Marjan. I am the Education and Learning Lead with Family Caregivers of BC. So I'll be sharing my screen with you. Let's see. There we go. Awesome. So like I said, this is our webinar on resolving conflicts in family caregiving. It's presented by two individuals from Mediate BC. And the instructions for today are everyone will remain muted and the cameras will be off. You will be prompted to reflect and provide feedback through the presentation. So please use the chat box feature if there's any comments you have, any questions you have. We will leave 5 to 10 minutes at the end for questions. And there is a specific option for the Q&A feature where you can type in your questions at any time throughout this webinar. And we will make sure that it is responded either during the questions portion or if there's anything specific related to tech issues, then we'll also be able to help you with that. As we come together today in this virtual space, I just want to acknowledge that we're gathering from many different territories across BC. I am currently joining in from home, which is situated on the traditional, ancestral, and unceded territory of the Coquitlam First Nations. So if you feel comfortable, please take a moment to introduce yourselves in the chat and share which land you're joining us from. So a little bit about Family Caregivers of BC. We are a nonprofit charity dedicated 100% to the well-being of family caregivers. FCBC was established 35 years ago and was the first organization of its kind in Canada, serving across BC since 2010 and funded as part of the Ministry of Health's Patients as Partners initiative since 2014. And our three key pillars are caregiver support, education and engagement, and collaboration. So today we have with us Sharon and Lori from Mediate BC, who will be presenting on this topic today. So I will pass it along to them to introduce themselves and get us started.
Yeah, thank you so very much. So I'm Sharon Sutherland. I'm Executive Director at Mediate BC, and I'm joining today from the traditional lands of the Tsawwassen First Nation. Delighted to be here and delighted to talk about this topic. I'll share just very briefly, Mediate BC, if you haven't heard of it before, is a nonprofit society. And the focus is transforming conflict resolution approaches. We really focus on delivering accessible, inclusive, and innovative is the language we use in our strategic plan, conflict resolution services. Where our focus is looking at the ways in which we can ensure voice. We can ensure that everyone has a voice in the matters that impact them. And we focus on, while our name says Mediate BC, and therefore we do have a really strong connection to mediation, we're really interested in all of those processes that support collaborative decision making. And as you'll probably not be surprised to hear me say, collaborative decision making is something that just profoundly changes the way in which we move forward in areas where we're talking about family caregiving. You'll see we've got bios here. I'll simply say for myself that I'm coming to this as somebody who has done family caregiving with a parent with dementia, has had some other experiences, and is in a current situation of setting up family caregiving across provincial borders with another parent and also doing work with nibbling. So we've got a number of different things going on. And so it's very present. And I'll pass it to Lori to talk about her background, but I think you'll hear this is a really important topic for both of us.
Thanks, Sharon. Hi, everyone. As Sharon mentioned, I'm Lori Frank. I'm currently the Director of Child Welfare Initiatives with Mediate BC. Am a mediator as well and have worked in various areas, including family conflict. As Sharon has mentioned, yes, this is a topic that is very relevant to our lives right now. This previous year, having worked with my own family through lots of decisions around my dad, now moving into some decisions around my mom, and also I'm a legal rep for a woman with disabilities and having to work through many healthcare decisions for her right now. So lots of personal experience from the two of us, and I think that we'll be sharing some of that and connecting it to our own experience today. So we hope that you find that really valuable, that those connections, and you'll likely hear things where you're going, yes, me too. I know exactly what you're talking about. So we'll get into things here. If I can get you to move to the next slide, Marjan, please. Thank you. So we have a very short amount of time, and this is a very big topic. So just recognizing we're going to be giving you some foundational information today to get you thinking about how to manage some of these things that may be coming up in your own life. And so it'll be some tips, some connections for you, some ideas around resources and so on. But just know that you can absolutely reach out to us after if there is more information that you need or connections that you're wanting or that kind of thing, because we've got a short amount of time, we won't be able to get into everything today. But what we will be talking about, we're going to be talking about some of those common causes of conflict, how some ideas around things to think about when you're managing those, how to create safe spaces, how to have those conversations with people in your life. What are the various tools that you might want to bring into those conversations to support everybody that is involved? What do we mean by collaborative inclusive? How do you do that? How do you bring all of the voices in, as Sharon was mentioning, so that everybody feels heard? And then we're going to talk about some of the options that are available, like I said, that you can bring outside resources that will help to support those conversations. So it's a lot, but we'll get through all of this today. So Sharon, with that in mind, we'll move to the next slide and I'll let you take it away.
Yeah, sure. Thanks, Lori. And I'm going to talk relatively quickly about this particular slide. We're talking about sources of conflict, and part of this is just recognizing and normalizing the fact that there are an enormous number of places of conflict. And I'm going to guess that if you're joining this call, you're probably already aware of some of the kinds of things that will lead to conflict and might be the sorts of things that are addressed when we talk about family caregiving. In particular, you'll notice the things that we've got listed here, things around future care planning, changing needs, inclusion of perspective, areas where you may run into challenges where family members disagree with each other. Family members don't look at things the same way, don't have the same values necessarily about where do finances get managed, how do they get managed. And they can be really, really ongoing sources of conflict for everybody. Change is one of the words that I'm going to just underline in that particular slide, because so many of them directly relate to those shifts in circumstances, because it's very often as one is addressing a change in capacity, a change in circumstances that might be affecting anything. There's so often those change points become a real flashpoint for conflict in virtually any family. And I wanted to also identify that we often think about these family caregiver conflicts as being primarily focused around different family members having different perspectives on things. But there's often strains that are outside the family too. The non-family participants and new family, for sure, that's again a change around bringing in new family. But you've also got disputes that in my circumstances with my father, the disputes were never with family members. We had the really good fortune of generally having a clear idea of what my father's wishes were and his desires, and a joint sense that we wanted to meet his wishes and desires. So generally, as a family, we were on the same page. Where we were running into conflicts were actually with the medical profession, with doctors in particular, but also with other agencies. We were having these ridiculous disputes around pensions and collecting and ensuring that we were actually accessing finances to support my father in the way that we wanted to see him supported. And that became a point of really big stress in our lives, was how do we carry on those? I'm talking about it here really to identify that all of these different places, whether it's directly because you're frustrated with some of the medical professionals and the ways in which they're engaging with family, the ways in which they're thinking about things, whether it's the different administrative bodies that you might be in touch with, could be many, many different people. It can be well outside family. And when you're in those stress moments around those caregiver decisions, those are equally stressful, and they're often quite hard to deal with. Similar kinds of things will come into play as we deal with each of those. I'm going to pass and ask a new slide and pass it to Lori to continue that line of thought.
Thanks, Sharon.
Yeah.
Yeah, so following that then, in thinking about all of the different people who may be involved in these kinds of conflicts, it can be a different constellation for different topics. So you may have a constellation of people that are involved in this topic and another group that you're needing to address another topic. And so it can become quite complex. And then within all of that is the family unit. And so thinking about my own family, there are 4 siblings. 2 of us live out on the West Coast, 2 still live in Ontario. My father's passed, but my mom is still in Ontario. So interprovincial, managing different healthcare systems. And then within the 4 of us, we are very different people. We have very different strengths, very different perspectives on things. And we're needing to come together, and we're people who don't necessarily see each other a lot. And I don't think that's an uncommon thing for families. We get spread out over time. We build our own lives. We have our own kids and all of those other things. And we're managing this now. So it brings a lot of complexity to the situation. All of those long-term dynamics and patterns that families have built. And some of those patterns may have gone by the wayside over time because we're not seeing each other as often or living in the same home anymore. And yet suddenly we're thrown back together in a difficult situation, potentially making difficult decisions. And we find a lot of those old patterns and old dynamics come back. And alongside those sibling dynamics, of course, then there's the relationship we have with our parents, which also plays into that. And I know in my family, each of us siblings has a very different relationship with each of our parents. So when we're making these decisions, we're all looking at the same problem from very different lenses. We have very different perspectives. For myself, for example, I have worked in the field of supporting people with disabilities. So I may have a very different idea around capability and capacity and self-determination than my brother, who works in government and in politics and so on. Very different backgrounds. So, but we're all needing to come together and make these decisions. And then where do our parents fit into the decision making, and looking at their role in all of this, because of course the decisions are being made about them. So it's a lot that comes together during this time, and it can feel very intense. It can be very stressful at times. And then, like I said, there's all those other things that are happening in people's lives. So I'm at a point in time where I have young adult children and all of the stuff they may be going through. So all of those things play into then the conversations you're having with people. And while you may be focused on a particular topic, all of those other things are swirling around you, and you're bringing all of that to that conversation. And so is everybody else that you're having the conversation with. So it's a lot to manage all at the same time. And so we're just talking about that to acknowledge that that exists. And what do you do about that? Because that's not going to go away. We can't suddenly put our other pieces of our life aside, or put aside old dynamics or patterns we had with siblings, or all of those things. They're all very present in these moments. And so we need to figure out, how do we manage all of that? So I think I'll pass it to you there, Sharon, unless there's anything else you wanted to add to that around your perspective on it.
No, I think that it flows really nicely into kind of the next slide if we want to move it along. What Lori is talking about is, recognizing and simply being aware of and conscious of all of these different things that are going on. One of the things that is interesting, and this is a fairly natural pattern, not for every family, but for many folks who are experiencing different kinds of family conflict, is that having this much can either be an overwhelm, or it can lead to patterns where we don't want to raise things. We don't want to trigger those kinds of reactions that we used to see when we were kids, because that person was so, reactive and it would look like this. Or we anticipate and predict different kinds of things that lead us to this space of conflict avoidance. And it's been really interesting over the last period to read some literature and some studies actually that have been coming out over the last 5 years around the ways that social pressures, and I'm going to say especially the pandemic and pressures around the pandemic and the changes in the ways we related to each other, have had a really profound impact on society and are notably leading us to be more conflict avoidant than we used to be. And that may not resonate, because many of us, when we're talking about what's changing, how is society shifting, we're saying, oh, everybody's so angry all the time. Things explode all the time. There's always this reaction, and everybody is just so rude, and all of these different kinds of things, whether that's family specific or that's how you're seeing social media, how you're seeing different kinds of influences. But what is interesting is that for those of us in the conflict resolution world, what we're seeing is that a lot of that is happening as a result of changing patterns about conflict, about the preventative conversations that we used to have, about raising something when we're first finding it frustrating, rather than sitting on it, because we're avoiding what we see as the bigger conflict, to raise this question and to identify that we've got a difficult topic that we need to talk about. So we're seeing patterns of conflict avoidance that are instead resulting in festering conflict, that we are just letting things get worse and worse and worse. And when we finally talk about it, we're not talking about it calmly. We're not raising it calmly, because we ourselves have hit a point of much higher levels of frustration, and we're not engaging in the ways that are the most effective possible. If you could change the slide, the first, so when Lori and I were talking about what are the things, we have a very short period. This is a huge and complex topic. So what are the things that are the most important? And for both of us, the most important thing really that was coming forward is not letting things build up, to not avoid the conversations that feel difficult or challenging, or we just are a little bit worried about getting into because it's just going to trigger things, and maybe we could just let it sit for a little bit longer. And so instead, really digging into what do you need to do to prepare for the conversation that you need to have at some point, so that you're less likely to delay it, and you're likely to create the best possible response to those. And some of the things that we can look at are really thinking of it as preparation. I am going to have this conversation. I am actively preparing to have the conversation. And that means thinking about, where do I have it? When do I have it? What is the space in which I have it? Do I do it on the phone at the end of a conversation about something else? Or am I actually saying, let's set some time aside. Let's do it in a comfortable space. Let's think about who's going to be there. Let's think about, are our conversations better if we have one-on-ones? Are our conversations better if we actually have everybody there? Is this something that is sufficiently challenging that we actually need to bring in some other person, whether that's a support person, whether that's somebody who is a professional? That could be, I think, mediator, because, I'm a mediator, so I think mediator. But that isn't the only people who can be those professionals who can support those conversations. It might be somebody who is providing particular care services for the loved one and has a different perspective that is very much more objective, or might be more day to day. Are there other people who should be involved? There are so many different ways we can go through this process. And a lot of what we do in our work is actually work with folks to think through, who needs to be there? How do we raise it? What language are we going to use to talk about this topic so it doesn't come across as adversarial, so that it's an invitation to conversation, so that it is, and I'll flag this because I have been lots of elder care in my background, and as a consequence, lots of engagement with understanding how yes and is an important part of bringing people into the conversation. And by that, I mean ensuring that one isn't just shutting down conversation and assuming lack of capacity and correcting, and instead inviting, let's build on those ideas. That's the kind of approach we want to be bringing into these conversations. Invitations to join, invitations to brainstorm together, invitations to work together towards common solutions, as opposed to, well, what you're doing is wrong. So there's a lot of different things we can do that are just about making sure we do it in the right space, making sure we've thought about it, and making sure we've considered the language and the approach that we need to use, and really thought about what the other person might be bringing. Lori, I know you probably have things to say on this topic too.
Yeah, I think just what was coming up for me as you were talking is that idea of preparing for a conversation, because I think a lot of times these conversations end up happening on the fly. You're in the same place together, the topic has arisen, and so you just kind of go for it without really being prepared to be able to discuss it. And so if you can take that time and space to think about it in your own mind, about where you're coming from, what your hopes might be, what other perspectives there might be, and actually, like you said, preparing for it. So if you find yourself in that moment of the conversation starting and it feels like, oh, here we go, to be able to be prepared to say, you know what, this is an important topic. Can we just take a minute and find a time that's going to work for us to work through this? So I think that's another piece of preparing for it, is knowing it's going to come up. It may come up at an inopportune time, and to just be prepared to say, hey, can we just put the brakes on this for a minute and think about when and where and how we want to have this conversation. If you want to move to the next slide, Marjan, please. So I think all of that then flows nicely into this idea. This is, I'm going to talk about two concepts here, and these are concepts we talk about a lot in mediation and in our mediation training, and it is one of the, basically one of the core roles of a mediator is to look at what people's positions are, and then help them to discover what is underneath that position, what motivates them. So a position is sort of that idea that you have of, here's the answer, here's what I think we should do. And often people come into conversations in that way. They come in going, okay, we need to make a decision around this, and here's what I think we should do. And the other person goes, no, I think we should do this. And that is their position. So then expanding on that, if you've got multiple people needing to be involved in these conversations, it's a lot of people coming in with their ideas around what should happen and what the decision should be. So a lot of positions. And often that's where the conversation gets stuck, and we circle around these positions, and people try to convince other people to take their position, and they defend their position and try to give evidence for that position and why should we all decide to agree with them. And you just get stuck there. You can probably call up some conversations you've had that have felt like that. It's very normal, very common for us to get stuck in that place. What we want to do is to get curious about people's positions. We want to try and understand where they came from when they came up with that idea, or why you should make that decision. And those are the needs. So when we're in mediation and we're having conversations with people, we're asking lots of questions. What is it about that that works for you? What's important to you? Why is that a priority? So we're asking all those kinds of questions to understand what is the need underneath. And so in these cases, what we might be uncovering are things like, I'm really needing to feel safe in my environment, needing to feel that mom is safe in her environment. I'm needing to feel like we can afford this. I'm needing to feel like I know what my role is. I need to feel what other people's role is. So those are the needs. When we get to that kind of conversation, we have a much better chance of coming up with solutions that work for everybody, because we're focused on meeting needs. So when we just even make a list of all the needs, here's all the things we've talked about, often solutions start to become much more obvious, and we can kind of go, oh, I can start to see something that could come together that addresses all of these things for people, needs around safety or money or all of those things. So I would encourage you, again, when you're preparing for these conversations, is to recognize, what is your position? What are you coming in going, here's what I think we should do. And then going, why do I think that? How did I come up with that as the answer to this problem? And thinking about what you're really needing. What is it that's bothering you or concerning you or worrying you? What is it that has brought you to that answer? And then if you can, we'll be making some assumptions in doing this, but thinking about other people's perspectives. What might some of their needs be? And thinking about, what do I not know about their needs, and what kinds of questions might I ask them in these conversations? So again, it's more prep, but if you can spend some quiet time by yourself, writing these things down, here's where I'm at, here's why I'm in that position, here's what I'm hoping for in terms of needs, not sometimes people go, well, I need to be on the bank account as a signatory. No, that's not a need just because we've thrown that word in there. Maybe what the need is I need to know finances will be stable. I need to know someone is managing the finances. That's the need. The solution, maybe something you haven't even thought of yet, and that's what will come out in the conversations. So yeah, just taking that time to go, here's what I think I want, here's what I think my needs are, and here's maybe what I think I know about other people, but what are some questions I would like to ask so I can understand their perspective as well.
Yeah, Lori, I would like to follow on the question about that preparation about what other folks' needs are and predicting, because that's an interesting point, because it's one of those spaces where we actually create conflict ourselves. We have a natural impulse. There's a bunch of different cognitive biases at play. We may not be intending to, but we will make unconscious assumptions about where people are coming from, and we will attribute different motivations to other people that are quite different than what we attribute to ourselves. We often will decide to do something for a reason that we understand the need for, but we attribute a character flaw to somebody wanting to do the same thing that we're in conflict with. I think one that I've heard folks use when talking about this is just when you're out, you're driving and you get cut off in traffic, and it's somebody you don't know, and your immediate reaction is that complete jerk, they were intentionally trying to cut me off, they were doing all of these kinds of things. You make it even worse if you recognize them and it's like, there's my ex. Oh, they were trying to kill me, because you're adding other layers to the motivation. But it's your close friend who cuts you off, and it's like, oh, they must be in a hurry. I wonder what's going on in their lives. Such a different perspective. And we need to pause ourselves on those kinds of reading motivation into our perception around needs and catch ourselves on that. If we're adding more to it, like Lori, the bank account one is a great example, right? I need to be on the bank account, but my actual need isn't that I need to be on it. My need is I need to feel comfortable, confident with it. They need to be on it because they're a control freak. We are having really different answers, and you can just test it by saying, if it were me, would I use the same language? Would I treat it as I'm a control freak because I want to know that this is working well? So when you're doing this, you really need to create space to hear what the other person might be saying around what their needs are, and really to allow for the possibility that what they're saying is genuinely what they mean. Or and does it matter if you don't necessarily believe that's where they're coming from? If that's what they're putting out there, can you have a conversation from the perspective that that is true? Because that will allow you to have a much, much better conversation.
Yeah. Yeah, I think that's a great point. We do make a lot of assumptions. And I know when I've had conversations with people and I ask, where do you think the other person's coming from? I'll follow that up with, and how do you actually know that? How do we know? How do you know for sure? And usually we'll bring up, when people ask us that, events or past experiences or those kinds of things, but it's not objective. It's our experience of it. We don't know for 100% that is their motivation or that's where they're coming from. And so absolutely, we attribute all of these things to it. So I think in making that list of questions, because I think if you ask yourself that question, how do I actually know that? Most of the time, if we're really honest with each other, the answer is, I don't know that. And so what do I need to ask in order to get that information or understand that better? So yes, thank you for the cautionary tale.
Well, cautionary only because, let's face it, we're talking about family, and there is no place where we have more history influencing the way that we are reading in what we think people are doing. That history is always, always going to impact the way we think about these. And in order to enter these conversations, we need to pull ourselves back from assumptions at all times.
Yeah. And I'm just noting a little bit in the chat here, someone noting how important curiosity is, and someone else going, I've just had a light bulb moment around my brother and maybe his motivations for around finances. So yeah, so that's great.
Yeah.
People seem to be we've all had these kinds of conversations with people, so we can connect on them and on many levels, I'm sure.
Yeah,
So,
absolutely.
move on to the next slide there, Marjan. Thank you. So we've talked about then some things that you can do yourself in preparing for these kinds of conversations. It can be difficult to, people often feel isolated in these things. Even though when they're surrounded by people, we can feel some isolation in our own thoughts and feeling. And sometimes there's, people who feel more responsibility and so on for resolving these things or taking on tasks and so on. So we have people will feel various levels of overwhelm and all of those things connected with everything that needs to be decided. And sometimes there are, we can only go so far on our own in trying to work through these things. So we wanted to talk about what are some of the supports available for having these kinds of conversations with whoever it is that you're needing to work with, family, extended family, care professionals, all of those people. So of course, one of the big ones is to rely on your own personal network. Thinking about who are those people in your life that you can lean on during these times, even if it's not to support this conversation, but maybe to support in something, taking something else off your plate so you can pay attention to these decisions and these conversations. So really thinking about your personal network, who are those people that you can call on and rely on, and being specific with them if possible. I know we all have probably been in situations where we wish we could help somebody, a friend or a family member that we see is struggling, but we're not sure how. So being able to say to someone, if you could just take on this one thing for me, if you could drive my kids this week, or whatever the case may be, that bringing those people around you and having them support you in those ways. There may also be people where, like we're saying, when you're preparing for a conversation, somebody you're feeling comfortable with, where you could sit down and just almost role play out the conversation. Here's what I want to talk about. How is that coming across to you? How does that sound when you hear me say that? How do you receive that? So having that kind of person to work through some of those things ahead of time. I know for myself, I find myself having conversations in the mirror sometimes going, and it just helps me work through something that I feel like is going to be a difficult conversation with somebody. So being able to actually bounce some ideas off someone else can be very helpful. Conflict coaching is a support that a lot of people I don't think are aware of. It's something that often mediators do in addition to mediation. And then there are people, sometimes counselors may take on that kind of role, but there are people out there who are conflict coaches. And the way that you can use that service is similar to what I've just described, actually, where you can sit down with them and say, here's the conversation I need to have. Here's how I'm feeling about it. Here's what I want to say. And they can coach and guide you on crafting the messages that you're hoping to share with other people in a way that people are able to hear them and take them in. They can help you work through some of the emotional pieces so that when you're having the conversation, you've already worked through some of the stuff that you may react to. So they can work with you in a variety of ways, whatever it is that you're needing, but it's someone who can help to prepare and support you. And after a conversation, you can use them to debrief. Here's what we talked about. Here's how it went. Here's our next step. And you can sort of help, they can help you along the way as well. And then, of course, as Sharon noted, mediation is you know, what we are the most familiar with, I suppose. Although I know Sharon and I have both done many different roles over time. But mediation then can be used where you've got an impartial person facilitating the conversation. This can be really helpful because when you have a family member facilitating, you don't have that same impartiality. They may be making really good effort to put their own perspective aside to make sure everybody's having a voice, but they are still then interpreting that conversation through their own lens and guiding the conversation and how they are interpreting everything that people are saying. With an impartial person, they don't have that same family relationship with you. They don't have those patterns and dynamics and that same lens. So they may be more able to hear things differently, to pick out things that other people might not hear, to hear patterns, to hear solutions within your conversation as they're starting to come up. So it's a very different role, having somebody come in and facilitate those conversations. I also wanted to note too, with mediation, we often attribute it to being of need when we are in conflict, but it's also something that can be used proactively. And so we see families choosing at the very beginning they recognize this is really complex and there's a lot of decisions we're going to need to make. And so they enlist someone at the very beginning to say, can you be the person that we keep meeting with as we make these decisions, as we do planning, all of those things, in anticipation that it may get difficult at times, and acknowledging that there may already be points of tension and so on that haven't come to the surface, but they just know that this difficult conversation might trigger some of those things. And so they're proactive and just using it as a planning tool throughout. Yeah, anything you want to add to that, Sharon?
I'd maybe build on what you're saying at the end there, Lori, because I think it's something that it's worth emphasizing, because people do very frequently think of mediation as something that happens when you're in crisis, you're in the highest level of conflict. It's, maybe we're avoiding court, but you have to admit at a pretty far along a path if you're thinking court is the other thing that might be happening. Whereas what we're finding increasingly in a lot of different areas that people are looking at, can you use something like this as a planning tool, as a prevention tool, as something to set up, here's what's going to happen, and also here's how we'll make decisions. So in the moment of a crisis, we don't need to be making that decision. And I'll use an example of elder care, for instance. Increasingly, we're seeing in those circumstances, we know there's going to be a progression towards less and less capacity for that person to be engaged in the decision making and to have self-determination. So engaging them as early as possible and supporting their voice in conversation early can result in recording that and agreements about how we want to value those particular opinions and how do we access them later on. It's something to think about. It's not one of those things where you're adding a huge financial burden. There's lots of different ways in which one can access that. It often prevents challenges down the road if you've got something in place early. And sometimes it's the easiest way to invite folks to participate in a conversation that's going to be a difficult conversation. So I want to say one other thing about mediation, because some of you probably have been in a mediation, but many of you probably have never. And one of the things that is interesting about it that we don't necessarily think about until we're there is that simply adding somebody who is from outside the family into the dynamic changes the dynamic. So if the challenge is that when the four of you sit down and talk about things, you fall into the pattern, and I saw a note in the chat about, what if it's about these embedded relationship kinds of things and nobody listens to the youngest sibling, even though they're now all in their 60s, or whatever those patterns are. People behave differently once you add somebody else to the mix. And often, if it's somebody from outside, that behavior is wanting to demonstrate what you believe, that you are the most reasonable person in the room. But that means conveying that to somebody else does mean needing to dig in and be able to pull out the reasons, rather than just say, I'm the oldest, I've always been in charge, and I'd like to continue to be in charge, which frankly, as an oldest, I occasionally catch myself effectively saying in discussions with my siblings. You gotta pull it in somehow. I'd never do that if I had Lori in the room mediating it. So just some additional thoughts on it. But yeah, lots of different possibilities, and we're focusing on a few, but happy to talk about a bunch of different ones.
Yeah.
I'm Lori, I'm just going to say, I see in the chat the question about working with folks who may have different kinds of challenges. And for me, those might be things like somebody may have a trauma reaction to engagement in different kinds of family situations. They may be coming with mental health challenges. They may have a variety of different things that are leading to really challenging conversations that escalate quickly and easily whenever those folks are in the room. And there may be different kinds of reactions to that. That's also another reason to sometimes include somebody else, so that it is not falling on the family members to continually try to work with that particular dynamic, because you fall into patterns of either giving in and feeling frustrated by the fact that you're always doing it to let that person, to ensure that the conflict is reduced or whatever those reactions are, sometimes that's a really good reason to specifically try and change the dynamic by including somebody else, whether that's a professional or whether that's thinking through which of the caregivers should be there or which other folks should be part of a conversation. Yeah. So there you go. Pass it back to you. I know we're
Awesome.
getting close to our time.
That's okay. If you could move on to the next slide, Marjan, please. Yeah, so I am recognizing the time. I'm also seeing there's some really good questions. So if we don't get to all of the questions, what I think I would ask is if Marjan could forward them to us, and then we can send answers out with follow-up information anyways around contacts and those kinds of things. So if we don't get to all of your questions, just know we can do that. And we'll just send them out to everybody because lots of people will probably have the same questions that are coming up here. So Sharon, do you want to talk about Ask a Mediator?
Sure. And this starts being a little bit of a response to questions about where do we find folks. One of the services we do is provide an Ask a Mediator workshop, or clinic. So you can sign up for a free half hour with a mediator. It might be me, it might be Laurie, but it's likely to be other folks. And if you've identified that it's about family or family caregiving, then you'll get somebody who works in that area. What it is, it's not a chance to hire people. Everybody who comes in, they're there to provide service. They're there to support you by answering questions about both mediation and conflict coaching and other kinds of services and resources that might be available. So it's often a good place. One of the things I consciously find myself suggesting often when I'm in those sessions is send the other people, because often the question is, I'd like to do a mediation. I think it would be helpful. I feel like the dynamic is difficult. And I don't know how to get my siblings to join me. I don't know how to invite these other folks in. They're resistant for whatever reason. Well, often it's not about asking yourself. Often it is, why don't you go and get information? You'll be talking to somebody else and you'll be able to ask any questions you want. So that is a tool you can use in a number of different ways, just to chat about your issues and talk about what might be available, or to encourage other people to learn more about it as well.
Yeah.
I'll let you take over with individual coaching and stuff if you'd like.
Sure. And actually, I note that there's a question or sort of a comment, I guess, in the chat there regarding coaching, just around there seems to be a huge increase in conflict coaches they've put in there who may not be educated or certified or regulated. And that is the case with conflict coaching, in that you will have varying degrees of experience and training and so on. So a place that you can start to know that people have a certain level of training are mediation rosters. Often mediators may also be doing conflict coaching. And so you will know that they have a certain level of training. But then I would also just ask, what is your training? What is your background? Those kinds of things, because it can be difficult to discern skill level and all of those things. I think I talked a bit about individual coaching. There can also be, you can bring a group together and work through in family coaching. Again, it's helping people to recognize the dynamic and the patterns that they have and how they might be able to have a different kind of conversation. So it can be preparation for then moving into the actual topics you need to talk about. The coaching can be, how are we going to talk about this? And the coach can then work with you around that as they recognize people's different ways of communicating and what the dynamics and patterns may be within the group. And then there may be some skills. So again, coaches can work with you on how to relay information in a way that people can hear it, and also how to receive it. That's a big skill, is listening to understand. listening without judgment and without thinking about how you're going to respond, and really trying to understand the information that you're hearing. It's not a skill that we learn in school, right? It's something that we develop over time to varying degrees, depending on how much time, how many opportunities we have to practice that. So that's another place where that conflict coaching can come in. I'm going to move to the next slide, please. So I'm seeing also in the chat several questions just about mediation in general, about the mediator's role, about getting to talk to the mediator privately, and those kinds of things. So I'll take you very quickly through the mediation process. When everybody has agreed to mediation, a mediator will then meet with everyone individually. We call them these pre-mediation or orientation meetings. They'll share some information with you, but a big part of that is for the mediator to hear about things from your perspective, to understand your perspective, to ask questions. It's not uncommon to have a little bit of coaching within those meetings as well around how to have these conversations. So everybody will have that individual meeting with the mediator, so that then when you all come together, the mediator already has a really good sense of where everybody's at, what the topics are that are needing to be covered, and what kinds of questions and so on. And they'll have a good sense of how they need to guide and facilitate the conversation. It's also an opportunity in those private meetings to make sure, do we have the right people here? Who needs to be in this conversation? Who does not need to be? What is everybody's role? So there's lots that happens in those individual meetings ahead of time before bringing everybody together. There may also be opportunities there to go, you know what? These things are legal questions, for example, and so we need to have answers to those before we come in. Maybe we have financial questions, objective information that needs to come into the discussion. So you'll also have an opportunity to identify all of the information that needs to be gathered in order to have a conversation. So a lot of planning goes into place before everybody comes together, so that when you are then together, it's an effective and valuable use of your time. And the mediator is prepared to help you have this conversation. And as we mentioned, the mediator is impartial. They're not there to advocate for any specific viewpoint or a specific person. They are there to help you all be heard and go, and now what? We're building some understanding, we've identified needs, and now what? So that's the role of the mediator. Typically at the end, they will document some things for you so that you've got a plan on where you're going next. So I hope that answers some of the questions that we're seeing there. And I'm recognizing we have 4 minutes left. So I'm thinking in terms of our next slide with resources, perhaps that's something we can send out in an email about how do you find people and where do you find these kinds of resources. And we may get to 1 or 2 questions.
Yeah, we might as well start on a few questions, but the slides definitely have contact information for Mediate BC. And if you're just at info@mediatebc.com or placing a call, any of those questions can be responded to. You can come to one of the Ask a Mediator clinics, but you can also simply send notes. And we're happy to look at different kinds of resources and supports and try to answer questions. But Lori and I will try to put together some list and respond to everything that we see in the chat, not necessarily now, but in a follow-up, as Lori said. But are there a couple that are leaping out at you, Lori, that we should talk about?
Taking a quick look here, and I don't know if Marjane has
caught anything that you particularly want us to answer here.
Sorry, because I'm sharing my screen, I can't really see them, but
Oh, okay. Yeah.
Christine, were you able to see any?
Yeah, I'm taking a quick look. I think we've covered some of them. And then it looks like some are a little more detailed. And so that could be something we could respond in an email with some of the resources and so on. Yeah.
I'm tracking some of the questions too. So yes, we can follow up with some additional resources and I'm just sort of seeing here.
Yeah, and a few of the, individual questions we can definitely follow up with directly as well if that's a possibility.
Yeah, if
Yes.
there are, yeah, and if we don't have your contact information, then you will have ours. So if you do have those more specific questions to do with your family situation, where do we go from here kind of questions, feel free to send those to us and we'll follow up on them.
Yeah. And I'll answer the funding question though, just because that's probably really relevant. There's a bunch of different answers to that question. There are different funding sources for mediation or for coaching. A lot of them are privately funded though. A lot of them will come directly from families, but there are other kinds of services, and Mediate BC tries to increase access. So at our organization, we have some lower income, lower cost mediation services. What we end up doing is sending out to a list of folks who are willing to take those and do some sliding scale mediations, which can include free mediations at the extreme end of things. But it's working with private folks. And depending on where you're located in whether it's like a child protection matter that is the caregiving, those will be funded by Ministry of Children and Family Development, whether it is parent teen, whether it is something that engages with elders in particular cases. Sometimes there'll be a funding source that's directly related to the type of work that it is and the type of relationship. That can include a variety of different things. So in individual cases, if you were trying to figure out how to access those kinds of things, that's a good one to call us about. We can often point you towards resources or opportunities to find either free sliding scale or private services, all of them.
Mm-hmm. And I'm noting someone's asked for the contact slide again, but I think, correct me if I'm wrong, we'll be sending out all of the contact information in a follow-up email so that.
Yes, that's correct.
All
Yes.
that, yeah.
Mm-hmm.
Yeah.
I'll also share it in the chat as well.
Perfect. Thank you, Marjan.
Easier to cut then.
Mm-hmm.
Awesome.
So many
Okay.
stories in the chat. I appreciate all the snippets of stories of your lives that you've shared in the chat as well.
Yeah, much appreciated. No, definitely, it's a pleasure to be here with a group that is sending such thoughtful messages and such thoughtful questions, and we're really happy to provide more answers if we can.
Great. I know we've gone a little over time, so my apologies to everyone. But before we wrap up, I just want to take a moment to just express our heartfelt gratitude to Sharon and Lori for sharing your expertise with us. I think your insights on conflict resolution within specifically family caregiving have been like incredibly valuable, and I'm sure everyone here has gained some practical strategies to apply in their own situations. So thank you everyone for joining us today, and I hope you all have a wonderful rest of your day.